a time when people have been standing at their doorsteps and clapping NHS staff, we believe we also need to stop and give ourselves a clap and be proud of all we have achieved and take a moment to celebrate and share the ways that all of us as OHP practices have shown resilience, innovation, agility and teamwork when responding to one of the greatest public health challenges in NHS's history.
At the start of March, the OHP board put in a crisis committee, and during the pandemic, we met every night. We reviewed what was needed at our practices and put together actions urgently to make sure our practices were safe.
We struggled to keep everybody at Ridgeacre up to speed with all the changes, so we borrowed a teleconference number. Now we're doing it on Teams, which is even better, and started meeting with the whole team every day for 15 minutes. Everybody knows what's happening and everybody can chip in their ideas, so what we decide, we know we're getting right for patients.
We needed a way to see housebound patients safely, so we introduced a new home visiting service for OHP practices across Birmingham Solihull. This coordinated PPE, Sancton Ambulance and Enterprise drivers, allowing clinicians to visit a wider area more easily. This meant vulnerable patients could still access vital primary care services.
I have been volunteering throughout the pandemic for our health partnership, delivering PPE equipment and other equipment provided by our health partnership to doctors' surgeries and health centres throughout the Birmingham area. I have also took blood pressure equipment to people's houses for them to use and return back to the surgery. I have found this very satisfying and I hope my contribution to our health partnership has been useful.
Overnight, the way we dealt with patient consultations had to change. No more face-to-face. We transformed the provision to telephone and video. Recently, we have moved to online consultations in a bid to further improve access and maintain staff wellbeing. It's saving time for patients and GPs, and it sets us up for a multidisciplinary team approach to delivering care.
We needed somewhere to see patients who are symptomatic, so we set up Amber Hubs in repurposed GP surgeries. We pulled together PPE, IT, OHP support and colleague collaboration, and we kept staff and patients safe.
We needed to be able to manage prescribing remotely. We utilised existing extended access facilities and worked with GP IT system capability to support our practices. This achieved paper-free management of prescribing without any interruptions in service to patients.
We were particularly worried about our shielded patients, so we set up a hotline within days. They were answering phone calls for help, for shopping and for prescription collections. The group is called Pulling Together Ludlow, and so far they have answered more than 1,000 calls for help.
At our practice, we wanted to maintain face-to-face mum and baby checks. We assigned a room to these appointments, removing unnecessary items to facilitate cleaning. We call mums the day before to explain how things will run. We have found that this has streamlined our process and helped reduce DNAs.
We were concerned about our vulnerable patient groups, so we contacted our shielding list regularly and worked closely with our social prescribing team and referred patients as appropriate. We continue to offer learning disability checks and chronic disease reviews via the phone where appropriate. This has given both staff and patients peace of mind.
We know our most vulnerable patients will be asked to pause their period of shielding from the 1st of August. So we are planning to offer dedicated nurse-led clinics once a week to cover the essential face-to-face healthcare needs of our patients that cannot be delivered remotely. The surgery will be closed during this time, with access restricted to those deemed high risk.
At the start of the pandemic, we learned that our elderly poorly patients wanted to die in the community. We contacted them proactively to ensure that the respect forms were in place. This meant that we were able to support them during their final days as per their wishes with the loved ones around them.
Everyone at Ridgeacre was really anxious at the beginning. I described my own emotional wobbles in a video clip that I shared with the team, and I was struck by how well that was received and opened the door to let colleagues share their own worries too. It really seemed to take down everybody's stress levels.
Clinicians are finding that during the pandemic, they were struggling with car keys and sharp boxes, etc., as well as donning and doffing PPE in cleaning the room in between patients. We developed a clinician's buddy from our enthusiastic reception team as a helper. The result was a more efficient and face-to-face service to our patients.
Realising I had to stay at home and shield during the pandemic was quite hard to take on an emotional level as much as anything else. Thankfully, OHP supported me with a laptop and my colleagues have kept in touch. I've maintained contact with all the staff, telling them tales about my animals and attempts to continue my sports training in lockdown.
It's our duty of care and my role to keep all staff safe in the workplace. During COVID, as well as social distancing, all our staff complete a daily risk assessment, asking if they are experiencing any of the COVID symptoms. By doing this, it reassures our staff knowing our workplace is safe to work in.
So just as it happened, our senior nurse Debbie was retiring midway through the height of lockdown, and we couldn't have a party. So each team member made a short video saying goodbye, and now Debbie has a permanent memento of how much she means to us. It's actually her favourite present.
We are working hard, it's still busy, and it's an ever-changing landscape. But let's not forget to reflect and celebrate these moments and recognize how they will influence the way we work and support our patients going forward.